We are moving next presentation. Heliodor Laskowski, creator of the Polish coastal artery and his kidney disease. Jaroslaw Sak. Not here?
Not here.
Okay. We are moving next. Horseshoe kidney, 500 years from the first report in the literature. Gambling, please. Yes. Sorry, I can translate.
So it's my pleasure to celebrate with you the 500 years from the first record of horseshoe kidney in literature. So, a rapid recap. What is the horseshoe kidney? Horseshoe kidney or renal quadus represents the most common renal fusion anomaly with an incidence of 1 on 500 in the normal population, with a male preponderance of 2 to 1. In more than 90% of cases, the fusion occurs at the lower pole. It can differ for location, orientation, and both arterial and venous anatomy variability. So, in individuals with horseshoe kidneys seems to be a higher risk for CKD. In a follow-up study in 146 adults with horseshoe kidney reported that the horseshoe group compared with matched control had the higher rates of urinary tract obstruction, kidney stones, urogenital cancer, and end-stage kidney disease. In another case series of 41 children, kidney scarring was found in 24%, proteinuria in 15%, and hypertension in 10%, with progression to CKD in 7% of the cohort. But which is the first report in literature? In 1522, Berengario da Carpi described for the first time this renal malformation in his masterpiece Suchodolska Brevis, Introduction to Anatomy. So Berengario da Carpi was a magister of anatomy and surgery at the University of Bologna from 1502 to 1527. He made several important advances in anatomy, including the first anatomical text augmented by illustration, Anatomia Carpi, Suchodolska Brevis per lucide ac perime in Anatomia Humani Corporis. If you want to read more and more on the life of Berengario da Carpi, you can check this paper of Professor De Santo and Carmela Bisaccia, where there is a full representation of his life and publications. So Berengario da Carpi was the first to describe the vermiform appendix, the first to see arytenoids as separate cartilaginous, the first to recognize the larger proportional size of the chest in the male and of the pelvis in the female, the first to give a clear account of thymus gland. So in this Suchodolska Brevis, he reported the findings of a post-mortem examination in the public autopsy hall of the University of Bologna in 1521. He wrote that kidney is continuous if they were one kidney, with 2 emergent veins, 2 emergent arteries, 2 reteric ducts. He said that I myself saw also in a public dissection in my study at Bologna 1 artery from the emergence making a channel on the right side behind the kidney, which at an extraordinary distance below the kidney went along the ureter, arising from the above-mentioned kidney, and both went through as one channel to the bladder. However, this emulgent artery also entered the kidney at the usual place, and in this individual the kidneys were continuous, like one kidney, and it had 2 veins and 2 emulgent arteries and 2 retears, with only one enveloping panniculus, which occupied the usual place of the kidneys, and even the middle of the back, which is the position between the spleen and the liver. a little below them. So moving on in the history of horseshoe kidney, in 1564, Leonardo Botallo further described and illustrated the characteristics of this atypical anatomical presentation. For there are 4 kidneys joined in one mass, but divided among themselves by channels, passages, and vessels. There were even a greater number of channels from the drains that are marked, but because of their smallness, I wanted only those which were more exposed to be reproduced. He also said that there is no need of proceeding here at greater length to set down the cause of an arrangement so abnormal and foreign to the right order of the nature. Since nature has equal power and equal impotence over the kidneys as with other parts of the body, which she sometimes doubles, sometimes mutilates, sometimes makes larger, sometimes makes smaller, and at times utterly different from the natural form. The next horseshoe kidney that was reported in literature was described by Leonard Dolbius during an autopsy in Nuremberg in year 1602. In 1654, Thomas Barton reported a case of horseshoe kidney with a precious iconographic contribution. In 1754, Ercurelli made the model normal kidney and horseshoe kidney on wax panel that is still exposed in the Museum of Palazzo Boggi in Bologna. In 1761, Giovanni Battista Morgagni discussed this condition not only as a rare anatomical curiosity found only in necroscopy, but discussed its physiological aspect, in line with his anatomo-clinical thinking. In 1894, Eddington accurately described a case of horseshoe kidney of a 5-year-old child. The kidneys present population on the anterior surface, but not on the posterior. The 2 organs are joined at their lower extremities by a band of what, to the naked eye, looks like kidney tissue, measuring vertically 5/8 of an inch, and anteroposteriorly 1/8 of an inch. We are in a epoch before the imaging, so the description is everything, and of course the drawings. In the 29th century, the horseshoe kidney assumed a more important role in urological diagnosis and its treatment, with the onset of renal surgery and with an increased frequency of its identification. In 1909, the division of the renal isthmus was first done by Martinov to separate the fused kidney, and later on, the details were described by Robspin and followed by a modification by Papin in 1922. In 1994, Foley advised the nephropexy in addition to symphysotomy. In 1962, Felton and Miller reported a successful resection of aortic aneurysm associated with the horseshoe kidney, stating that there is no answer in the division of isthmus to gain access. So the vascular anatomy of a horseshoe kidney is usually complex. Urethral and collecting system abnormalities are also common. But in 1963, we had the first transplant for an horseshoe kidney. And from this date, a lot of more transplant of horseshoe kidney has been done with a successful outcome. Finally, we have the imaging of horseshoe kidney. With the advent of pyelography, imaging of reports of horseshoe kidney permitted a more accurate representation of the all anatomical variants, which was particularly useful in preoperative evaluation and outcomes. So the horseshoe kidney gradually took its place in medicine through the years. At individual ages, it was seen as a curiosity or a monstrous anomaly. As the medical science gradually developed, the anomaly was not only recognized as a congenital malformation, but symptoms and other lesions that might accompany the horseshoe kidney were also discovered. Berengario da Carpi was at the basis for a better knowledge of this anatomical anomaly, and after 500 years from the first level in literature, relevant advancement in the treatment of the horseshoe kidney-related complication and diagnosis have been performed, confirming the need to monitor the individuals with this condition who are at higher risk for chronic kidney disease development. Thank you.
Any question? Please.
Very cool. The field of this nice presentation. You are a really great watcher of the history.
Thank
You
you.
have brought us forward with this name. It should remember worldwide, and also now you bring us our attention to 500 years ago, and this is the great achievement that this is a topic of great relevance, because many great surgeons also in Italy have done their fair on this topic.
Thank you so much.
Thank you. We are closing the things. Thank you very much for everyone. Yeah, we have coffee break.
Okay.